Good afternoon and welcome. I'm Shingi An, the director of Yonsei Institute for Global Health and also vice chair of the Institute for Global Engagement and Empowerment. Today I'm very honored and delighted to moderate this session entitled with the Strategic Plan to Achieve Access to Surgical Care in the Asia-Pacific region. What we are really talking about is health equity in terms of access to safe, affordable, and timely surgical care to all who need it. Last October, the member states of the WHO's Western Pacific region endorsed the Regional Action Framework for Safe and Affordable Surgery. That is recognizing the indispensable role of surgery in ensuring a resilient health system. Today, we have a Minister of Health of our member state, an academic, and representatives from cooperation and financing agencies. They all play a vital role in achieving safe and affordable surgery for all. So I'd like to introduce them to you briefly. First, here we have Dr. Iferemi Wakanaviti. He is the Minister of Health and Medical Services of Fiji, and he is also a surgeon. And then here we have Professor John Gerard Mira. He is the Clatchian Professor of Global Health and Social Medicine of Harvard University School of Medicine, and he is also a plastic surgeon, and he is directing the ACTIVE program, the program for global surgery and social change. Thank you. And here we have our place. Here we have Mr. Taesu Kim. He is the Executive Director of EDCF, Economic Development Cooperation Fund. You know what the EDCF is, the major fund for Korean ODA loans. And then here we have Ms. Hyunwon Kim. She is the Director General of the Climate Crisis and Pandemic Response Department of KOICA, Korea International Cooperation Agency. Coincidentally, she was serving as the former representative and founding director of KOICA Fiji office. So once again, thank you for your participation. So let's jump in our discussion and our conversation. First, I'd like to give a question to Minister Wakanaviti. Thank you for joining us today. As we know, the COVID-19 gave us unprecedented impacts on all the aspects of our lives, and the influences are still going on and on the way. Of course, the COVID-19 has caused various change in the health sector too, in our society. So I saw the video when you proposed the governmental budget for healthcare of Fiji in the last year. You said that the COVID-19 crisis is the first time in your history. So could you briefly summarize the current status or current situation of Fiji related to COVID-19?
Thank you. Thank you, and thank you for this opportunity to be part of this esteemed meeting. And can I share the slides that I have with me? With me also here is our Chief Surgeon, Dr. Chisese, pediatric surgeon, and our Head of Family Health, Dr. Rachel Devi. Can I have my slides? I have a few slides that I'd like to share.
So could we have the presentation slide? Okay. Mm-hmm.
Thank you. Fiji so far, in total, we've had 56 cases of COVID-19 with 2 deaths. And we had them in March, the beginning of the year. It is now 292 days since we've last had COVID-19 in our community. And so far, we haven't had any other COVID-19 within the community. If any, we've had border quarantine cases. Next slide, and then the next slide. Next slide. Next slide. Thank you. The important things that we've learned is to ensure that not only do we have policies, but you also drive legislation around how you push out the measures around COVID-19. And I think this is so important, that unless we amend and we make the necessary legislation, it will be very difficult to be able to be very stringent with the measures around containment. And that's what this slide is talking about. Next slide, please. We've had very effective leadership by the Honorable Prime Minister, who's been very engaged, and also a very engaged cabinet. And with a whole of government and a whole of nation approach, we've been able to keep COVID-19 from outside of the community for nearly 300 days. The other important thing, and this is something that the UN resident coordinator alluded to, he said, not only do we have effective leadership, but we also have a community that's willing to listen and to take on board the measures that have been asked of them to be able to ensure that we are COVID contained. Next slide. It's also important to ensure that we have risk communication. And for a country which is a small island development state, middle-income country and low-income countries, this may mean actually going out into the communities, settlement by settlement and village by village, to be able to get the message across. Next slide. Next slide, please. We've also noted that whilst we've been able to keep Fiji COVID contained, it has had a significant impact on our economy, because nearly 40% of our economy is dependent on the tourism sector. There's about 10 to 15 backhand industries behind the tourism sector. When we talk about backhand industries, talking about flight attendants, talking about the engineers that look after our aeroplane, talking about the travel industry locally that actually looks after the tourists when they're in town, talking about the restaurants, the farmers. So these all have been affected. And we've tried to, as much as possible, since we've been COVID contained, to be able to allow quarantine contained or blue lane in terms of being able to get this tourism sector up and running a little bit. And we're looking forward with a lot of anticipation that we can be able to develop a bubble with countries around us. Next slide. What have we learned? We've learned some important lessons. We've learned about how we need to remodel, we need to pivot, we need to ensure that we push out universal health coverage, because that's what COVID-19 is wanting us to do, to have a population health approach rather than a singular institutional approach. Because that is the way in which we can be able to protect the whole population. We also are finding ways that we need to be able to empower the divisional setup. There's about 300 islands in Fiji, 100 of them inhabited. How do we ensure that the island that's on its own is able to continue working despite the challenges that are being faced elsewhere? And really moving very quickly into the digital age, because that is the way forward for us. Next slide. And we've suffered so many cyclones throughout the past year. Past year alone, we had 4 cyclones, 2 of them severe tropical cyclones, one just before Christmas, and we've just had another one just pass us about last week, which is now day 9 now. So we've had 5 or 6 cyclones throughout the period that we've had COVID-19. So how do we deal with the issues of your normative function, the fact that you've been pushed with a global pandemic, the economic onslaught, and also the disasters that are around us? And one thing that we keep on talking about is making sure that we are resilient dividend, that we make health gains despite all these challenges. And so we continue to push out with safe and affordable surgery, continue to push out with our universal health coverage, mitigating communicable diseases, and using our WHO EMT certified team to be able to meet the extra normative functions, especially around disasters. Next slide. Thank you.
Thank you for your kind summary and very informative one. And so I'd like to give a question to Professor Mira too. By the way, what time is it now in Boston?
It's about 11 p.m.
Wow. So it's quite late for you, but thank you again for joining us today. So you and your team, the program in global surgery and social change at Harvard, are at the front line of the global surgery movement. So please tell us about how surgery fits in the global health landscape and what changed you've seen since the Lancet Commission on global surgery.
Well, thank you, Professor Shinki. It is an honor to be with you and to be with all of the panelists today, and thank you very much for inviting me. So, historically, surgical care was not terribly well recognized as part of the global health dialogue. In fact, Jim Kim and Paul Farmer wrote in 2008 a now famous article in which they said surgery was the neglected stepchild of global health. And that has become a somewhat famous line. When you go to global surgery meetings, you will hear people mentioning that. Now, they explained why that was. They talked about the fact that surgery was perceived to be too expensive, or it was a luxury, or it was too complex, or it was not a priority. And they did a very nice job of debunking all of those theories. So that was in 2008. In 2015, you alluded to the Lancet Commission, and 2015 was an important year. So Disease Control Priorities 3 was published from the World Bank, and the first volume was on surgery. The Lancet Commission published its findings, and probably most importantly, the World Health Assembly passed Resolution 6815. So 2015, that year, really highlighted the integral nature of surgical care in a properly functioning healthcare system. Now, since then, we have seen surgery, obstetrics and gynecology, anesthesia, and the trauma communities, amongst others, coming together to approach surgical system strengthening holistically. So instead of doing this individually, we've seen all of these communities come together as one. And we've also seen ministries of health take strong leadership. For example, we've seen countries like Fiji under the leadership of Minister Wanga working with local stakeholders to create national surgical strategic plans that include the whole surgical ecosystem and all the specialties. We've also seen international efforts to collect surgical data for accountability and to demonstrate improvement. And this data is now in the World Bank World Development Indicators section. So I'm so encouraged today to be part of this panel with these esteemed colleagues. And it gives me hope that we will be able to incorporate surgical care into health system strengthening, working towards UHC and the SDGs. Thank you so much.
Thank you. Thank you for your answer. I believe you're going to explain your definition of BC in later. So I hope that we could understand the new meaning of BC and the AC. So, and well, because we have many international participants through online, so I'd like to introduce our important two agencies. So first of all, Mr. Taesu Kim, welcome. Can you tell us about the Kaexim Bank? The Export-Import Bank of Korea a little bit?
Yes, I am Kim Taesu from Korea Exim Bank. It's my great pleasure to take part in this meaningful forum with distinguished participants. I am in charge of the concessional loans for the developing countries in my bank. Korea Exim Bank is a Korean official export credit agency with full government support. And also Korea Exim Bank is the operating agency of Economic Development Cooperation Fund, which is official development assistance program. EDCF support partner countries by extending concessional loans for infrastructure projects in line with their development strategies. Since 1987, Edcf has committed total $19 billion to 57 countries with 470 projects. Korea Exim Bank support partner countries for construction of public infrastructure by diverse financing tools like export credit, equity support, debt guarantee, and Edcf. In the healthcare sector, Edcf plays an important role in building hospitals and supplying medical equipment. Edcf has supported $3 billion in concessional loans to 69 projects in the healthcare sector until last year. Most of them are for support of building hospitals and supplying medical equipment. Why do we give financial support in building hospitals and supplying medical equipment in the healthcare sector? First of all, physical accessibility. All people should have timely access to health services. What if this is an urgent situation requiring immediate treatment? A severe trauma case inflicting great pain such as a traffic accident. Whether or not fatal consequences will be faced depends on the access to the hospitals with quality health care. Second, we need to consider sustainability. Unaffordable services cannot be sustained. If the patients are not satisfied with or are afraid of the service due to bad outcomes or too expensive cost, such a service provider will not be sought for. So sustainability is one of the key issues in the healthcare services. We expected quality care from the hospitals. Simply building a new hospital is not enough. It's not enough to provide good medical services. The hospitals should be managed effectively and efficiently, and medical staff needs to be trained adequately. That's why Korea Exim Bank is expanding collaboration with grant-based support organizations. There are various health-related organizations in the international community. And also in Korea, there are several institutions dealing with health issues. The Korea Foundation for International Healthcare conducts grant-based training programs for medical personnel. And also Korea International Cooperation Agency provides grant-based support for medical facility establishment and fellowship programs. As medical services are improved through cooperation of these institutions in Edcf health project, disease in the area will also decrease. Moreover, with the increase of quantity of services, the unit cost per surgery will decrease with increasing efficiency. In the Lancet paper written by Dr. Miara along with other public health researchers, surgery provided to be the most effective intervention in the macro and microeconomic perspective. Korea Exim Bank does not support the surgery itself. However, for Korea Exim Bank, as an ECA and ODA agency, providing support to surgical treatment is a valid decision to make. Thank you.
Mr. Kim, thank you for your kind support for this concept and for your explanation. And here we have Ms. Hyun-Won Kim, I'm so glad to see you and to have the KOICA's presence here today. So for once again, for the mutual understanding, could you tell us about KOICA briefly?
Thank you. Let me thank you for first the opportunity to participate this meaningful session with distinguished panelists. And I'd like to give a special greeting to the Minister and Fiji, Bula Vinaka. I went to Fiji to reopen the KOICA regional office, South Pacific regional office in 2016, and the Pacific seems to be my second home. KOICA have made a contribution to universal health coverage and for achieving Sustainable Development Goal 3 by providing decent basic health care services since its establishment in 1991. Even now, 44 country offices and headquarters staffs are working together to fill the gap of health vulnerability in more than 100 countries. I cannot help but talk about COVID-19 while discussing on health sector issues and health strategy. Due to the nature of infectious disease that do not respect borders, global cooperation is even more essential. From the development cooperation perspective, that's why KOICA announced the ABC program, which means Agenda for Building Resilience against COVID-19 through development cooperation was launched in last year, 2020, and we are keeping on that track up until 2024. In line with that, we also preparing new midterm health sector strategy. So we are keeping on our efforts on the universal health care, including the health system strengthening and the quality of health services, considering life cycle, and also health security issues, including pandemic response and preparedness. And last year, more than $130 million has been provided to more than 32 million beneficiaries in 110 countries. And we will keep our effort to overcome this crisis this year too. I will stop here for now, and I would like to discuss further later. Thank you.
Thank you. So, let's go into the further discussion. And I'd like to give you, each of you, a question, and we are going to hear an answer from you. But because of time limitation, I can give you 8 to 10 minutes for your answer. So first of all, I'd like to give you Minister Wakanavati as a surgeon and the Minister of Health, Fiji. So you, for a long time, you have been a champion for safe and affordable surgery. So can you tell us about the evolution of surgical care within the scope of global health from your perspectives as a minister? And what are the key factors that lead to adopting the regional framework for safe and affordable surgery? Minister Wakanavati, please.
Thank you. As I've alluded to earlier, I have with me our Chief Surgeon, Dr. Cheseji Turangaba, who's also the National Coordinator for Safe and Affordable Surgery, Anesthesia, and Obstetrics. We've said it before and we'll keep on saying it again. There's no universal health coverage without safe and affordable surgery, anesthesia, and obstetrics. It is part and parcel of, the public health aspect, especially in low and middle income countries. By strengthening safe and affordable surgery, we actually strengthen the whole health system. Professor John Murray is here, one of the senior authors of that Lancet Commission, in which they talked about, the discrepancies that exist with safe and affordable surgery throughout the world, and why low middle income countries such as Fiji and small island development states struggle. We struggle because the numbers are against us. 5 billion people do not get access when they need it to surgery. There's another 150 million procedures that are needed to be able to fill the unmet need. 35 million face catastrophic expenses after surgical care yearly. and investment is needed. Investment is needed locally, investment is needed from development partners to be able to strengthen what is being done locally. One can also look at the map and see that the high-income countries have access. They have access to more density of surgeons. They have access to more procedures. And they have access to procedures that may not, are much more than just life-saving. For example, cosmetic procedures, where there are many countries around the world, they struggle to even have access to life-saving procedures. In the Pacific, since that Lancet Commission, we've been working with the College of Surgeons and together with the Harvard Global Surgical Group. Since 2017, we put Iron Soap together. 2019, as we all know, that the side events that happened again at the WHO in Geneva, apart from those that have happened before, and 2020, with the leadership of the current Regional Director, Dr. Takeshi Kasai, the Western Pacific, and I'm proud to say this, that our region has come together and say, let's develop a framework for the next 10 years at least on being able to ensure that the whole Western Pacific embarks on this important, journey of providing safe and affordable surgery. In the Pacific, we have Fiji, Vanuatu, Tonga, the Cook Islands, and Palau that we have come together to be able to put our soap. And just recently, our chief surgeon has been working with our surgeons and obstetricians and anesthetists, and again, in doing a very comprehensive ENSO, or National Surgical Obstetric and Anesthesia Plan, of all our other facilities. As we speak, we have 3 main hospitals, but we've had to open 4 bellwether-capable facilities after the 2 cyclones that have gone past us at the moment. And we know that these bellwether-capable facilities will have to make it permanently in the not-too-distant future, because to do so will ensure that we have up to 90% of our population have access to bellwether-capable facility within 2 hours. We want to continue to push and ensure that we have permanent staffing in terms of the human resource, but also in the needs around the facility upgrades that are needed in these facilities and also the equipment. But as I've said before, we face the growing challenges of the economic constraints because of the global pandemic. And we are talking as much as we can. And if there are development partners that are listening today and want to, work with us, we'll be more than happy to let them know about our proposals, because we really want to continue to pursue a safe and affordable surgery. We have a training program, and we have a training program that we know actually meets the needs of the Pacific. We train for the Pacific, from the 19 countries of the Pacific. And so once we have the human resources, and government in Fiji has made significant increases in salaries of doctors and specialists to be able to keep them. But because of the challenges we're facing with COVID-19, the economic constraints, we need support to be able to rapidly build up the bellwether capability of these facilities that I've alluded to. And as I said before, we've got more than 300 islands, 100 of them inhabited. We want to make sure that no one's left behind, that we are reaching the unreached and no one's left behind. There exists, and I want to finish by saying this, there exists at the moment a black hole for medical products around the world. There are a lot of countries around the world with mass community transmission of COVID-19. There's a need for PPE. There's a need for antibiotics. There's a need for IV fluids. And the economies of scale are against small island development states. Economies of scale are against small economies such as ours. The challenge we face is to ensure that our normative functions, including pushing out universal health coverage, safe and affordable surgery, is not dwindling in the presence of a global pandemic that we face. Thank you.
Thank you. I hope we can have a chance to interact together after another round of questions. So I'd like to give you a question, Professor Mira. I have seen your speech at the Boston Global Surgery Symposium. At your speech, you explained the importance of surgical care with a word of Dr. Paul Farmer and or a very particular example. There are HIV/AIDS patients who they over-treated with very expensive drugs, but who had a ruptured appendicitis. They unfortunately lost their lives because of the lack of the safe and affordable surgery. So I could learn the importance of the surgical care for the promotion of global health through your sharing and your testimony. And this case, I mean, the examples that you shared can be a reminding call of the need of surgical care for global health. But as you already mentioned, we have not enough recognized the role of surgery because we still have this stereotyped understanding about surgery. Surgery is very expensive and just available for a few beneficiaries. So in this respect, could you explain more or in detail, why do we need a take action for global surgery in global health? This is my first question.
Well, thank you, Professor Shinki. I'm glad you brought up that story with Paul Farmer because I think it's really important to highlight the fact that, Paul Farmer is an infectious disease doctor. And I remember asking him specifically the question you said. I said, Paul, why are you so passionate about surgery? You're an infectious disease doctor. And he gave the answer that you said. He said, look, it doesn't make sense. It doesn't make sense to invest in a vertical HIV program when the next day the patient dies of appendicitis. And he was highlighting the fact that surgery is a cross-cutting discipline, that healthcare is holistic. And for example, that surgery cuts across all ages, all medical conditions. There are surgical conditions in the young, in the middle-aged, in the elderly. Infectious disease patients often need surgery. Cardiovascular patients can need surgery. Trauma patients can need surgery. So surgery is different in that respect. It's not a diagnosis per se. It's a treatment that cuts across the entire human condition. And I would ask everyone listening today, have you had a surgical procedure or has someone in your family? And I bet most people will say, well, gosh, yes, I have, and my father has, and my brother has. And, it's a statistical fact that almost all people throughout the course of their life are going to require some type of surgical procedure or care by a surgeon or an anesthesia provider. So that's why it's important to take action. Now, what does taking action mean? Well, it means planning, and Minister Wonga talked about that, and he's been a wonderful example of a leader who is helping his country go through that planning process, and a region, quite frankly, the whole Pacific Island region. So it takes planning, and it takes political strength and courage, and it also takes investment. And we can talk about that a little bit more, but I will say that the Lancet Commission did some modeling work and looked at low and middle income countries over a 15-year period from 2015 to 2030. And it's a staggering amount. We came up with a number of $350 billion to advance surgery to an acceptable level. So what else do we need to do? Well, we need to change the dialogue from vertical interventions to holistic care. And it's not, surgery versus infectious disease. It's not surgery versus, non-communicable disease or communicable disease. It's really, how does surgery fit in healthcare as an equal player, as an equal participant, as an added benefit to a holistic healthcare system. And so if we don't change that dialogue, then we end up just arguing with ourselves over what we think is a fixed pie. I want more money for surgery, or I want more money for this, instead of, the way Paul looked at it, which is we have to take care of human beings, and they need different aspects of care. And then I think the last thing I'll mention in terms of taking action is, you almost have to talk about the present issue, which is the pandemic we're in and COVID-19. And I don't want to COVIDize everything. I don't want to securitize every discussion. And I think we can fall prey to that, where everything's related to pandemic preparedness or global health security. But having said that, if you look at many of the healthcare systems, how did they respond initially to this pandemic. You know, how did they expand? Well, they turned their operating rooms into intensive care units. They turned their recovery rooms into intensive care units. They pulled anesthesiologists and surgeons and turned them into acute care doctors. So the one interesting thing about surgical workforce and surgical infrastructure and even surgical consumables and PPE is it was somewhat of a reservoir for expansion of care in this pandemic. So I'll pause right there in case you have another question.
So I think you mentioned the importance of change, the paradigm or change our understanding about the medicine or medical care. And at the same time, I believe you emphasize the importance of networking between the surgical section and or the infectious disease control, or because now we have our panelists, we have all the important stakeholders in global health today. You know, we have the international cooperation agencies, for example, COICA, and also funding agencies, the EDCF. So what should or could we do for the global health network to improve the global surgery or to overcome the current problems?
It's a very good question, and I see some positive things occurring, and Minister Wanga mentioned that. Ministries of health like his, as I said, and as he mentioned, have had the political will to begin what is really an organizational change project. So having the foresight to say, surgery, OB, anesthesia, trauma care, this is part of a healthcare system, and making that commitment, which they've done. The other thing that's necessary is working with the WHO and with WIPRO. As Minister Wanga mentioned, WIPRO has provided tremendous leadership, and that's so very important. This is not something that a single academic institution can do. This is not something, you know, even look at Minister Wanga's region. They're approaching it as a regional effort, not just as a single national effort. So I think those types of initiatives are extremely important. And I have to say, I've been very impressed and pleased with how we're seeing that change, that thought process change, that organizational change process. And so now what do we need to make this sustainable? And it's really capital. You know, we need to invest in this initiative. So the question is really, what is the role of regional banks? You know, what is the role of impacting investing? How do these early NSOPs, these early surgical plans, how do they attract capital? You know, because these plans without funding are just paper documents or electronic documents. That's all they are, all right? And achieving surgical system strengthening and achieving sustainability is going to require capital flows. Now, I'll take you back to the comment I made earlier, which was that the Lancet Commission modeled that it would cost $350 billion in low and middle income countries. But what we also did is looked at what might that type of an investment do to those economies. And it could add upwards of 12.3 trillion to those economies over that 15-year span. So, you know, the return on investment is really quite positive for society. And this is, quite frankly, something that, you know, the commission before ours, the Lancet Commission on Investment in Health, they found something very similar, that investments like this in health and in particular in surgery are really very positive in terms of the return.
Okay, thank you. Let's move to the our EDCF partner, and Mr. Kim. Based on the comments from Minister Wake Navati and Professor Mira, we can expect many ministries of health in the Asia Pacific region to develop national plans to strengthen surgical systems. And as Professor Mira mentioned, it requires a significant amount of capital and financial investment. So how can the Korea Exim Bank support this massive project to ensure safe and affordable surgery in the Asia Pacific region? The Korean Exim Bank provides great support to tertiary level hospital, and how does the regional prioritization of a universal access to safe and affordable surgery change Exim Bank's strategy?
Thank you for your good ideas. From now on, we will try to accept your good ideas in doing our businesses. I know well how much the damage from COVID-19 is throughout the world. Considering the difficult situation, my institution is making a plan to expand the support in the healthcare sector. At this point, I can say health sector is one of our priority sectors to cooperate with, especially developing countries. Edcf provided the $470 million in the healthcare sector last year. And also this will be increased every year. The experiences of the COVID-19 taught us the importance of strengthening the health systems, and financing is one of the most important sectors for them. The role of the international community is especially important when it comes to financing the establishment of health systems in our partner countries. As for the international entities that can serve the role, international financial institutions such as World Bank, IDB, or ADB will be the ones. These institutions have rich experience and know-how in managing international projects. Their development projects are suitable for ODA institutions of individual countries to participate in as co-financers. As the U.S. plays an important role in World Bank and IDB, if such institutions participate more actively in establishing health systems in the Asia-Pacific region, it will be a meaningful message for other international financial institutions and ODA agencies. Moreover, policy and governance must be improved to support the infrastructure and human resources. In turn, service delivery will be expanded both qualitatively and quantitatively, and perceived outcome of the health services will be improved. With continuous health system transformation, the partner countries will be liberated from the burden of disease. This is the new vision that Korea Exim Bank suggests with the global surgery experts today. Thank you.
Wow, quite the very supportive and very inspiring remark. And by the way, personally, I'd like to give my appreciation that EDCF did not cut the budget because of COVID-19. I need to say, in spite of COVID-19. Thank you for that.
Yes, okay. We will try.
Good to hear that. And Hyunwon, how can KOICA become a key partner to the low-middle income countries in their effort to achieve a safe and affordable surgery for all? You know, like South Korea has some of the best surgical workforces, such as surgeons and nurses, anesthesiologists, and we also have a world-class medical and surgical industries. So what would be the better or best way to harness all of these resources? And how does this relate to the new strategy of KOICA between 2021 and 2025?
Thank you, Chair. Thank you for the very important question and big one. To be honest, I think there is no way to answer to or solve the problem at once, because the situations and conditions of all countries are varied and different. And we need to understand very well the context of each country and approach it step by step with basic principles, I guess. also we need some sort of flexibility and creativity we approach to solving the problem. And previously, Exim Bank emphasized accessibility and sustainability, and I think that we need to think some more basic principles like equity, quality, efficiency, and resilience, etc. That in line with the comments from the Professor Mera and the Minister. And these principles should be reflected and used to identify the area to intervene and in diagnosing gaps between present and the future that we expect, so that each country's health system can provide safe and affordable surgery. And you also mentioned about the Korea's abundant or high-profile, high-skilled personnel, medical resources. However, sometimes I'm in the field, I'm thinking about how can I solve these kind of health issues in this country, and how I can mobilize Korean resources to solve this problem. But sometimes Korean experts does not have any experience in the development countries or different system, different regulation, different equipments, infrastructure, etc. So we need to be cautious when we're thinking about like a supply or needs like that. But like KOICA and Exim Bank, other international developing agencies need to providing some sort of interface or platform to so that both sides can meet and cooperate to solve the issues. And I'd like to share my experience while I was in Fiji and looking after other countries like Papua New Guinea or Solomon Islands. In line with these kind of planning and designing new programs and things, I put up all different kind of modality to assisting the Fiji government or other Pacific Islands government to advancing and to be supported. For example, from my experience, Korean ENT doctor was in our office and he was willing to serve in Fiji. So now actually he's in the CWM hospital as an ENT specialist, a global health doctor, supported by KOICA. And I utilized the resources like nurses who have come over for volunteering. They served in frontline healthcare services and health centers. However, due to the COVID-19, it's postponed a little bit for a while. And like senior experts who have many experience in each field are invited to work in ministries to supporting policymaking. So, and in terms of the infrastructure, we plan together with the Minister of Health if there is accessibility issues in certain area, so that the community can have a full access to the safe and affordable healthcare services, including surgeries. So like this, not like if there is the skilled people and there is a will of the government, and also from the support from the international community and the regional hierarchy like WIPRO or WHO, we need to work together to solve what would be the next step and what would be the quick win agenda items that we can solve first, and then we can planning for the mid to long term pathway and roadmap to eventually achieving the affordable and safe surgery, including the UHC, I guess. Thank you.
Thank you. By the way, it is certain that we are living in a very special era and the special times. So now we are having an international meeting. So we have participants from Fiji and also participants from United States, Boston, and we are in Korea. So we were supposed to meet face to face, but now we are now we are meeting face to face through IT-based platform. So I'm very happy to have this format. So when our Korean colleague, talk something, so I cannot see your face. Professor Mira or Minister Wakenabeti. But yeah, it's good for us. So if we have any comment from Korean side, just maintain this format. So I'd like to see their face. Am I right? Can you hear me? Thank you. Thank you for your support. So it's quite, for me, it's, I'm a cardiologist, so, but now I'm working at the Department of Medical Education, also participate in the development project, international development project through the medical education. So this experience, your talk and your comment is a quite eye-opening experience to me. So before wrapping up the sessions, I'd like to give you a final, not final, but a question. It can be the same question to all of you, because you know what, the hosting organization of this event is the Institute for Global Engagement and Empowerment. So we'd like to find out a way, as you mentioned, comprehensive way, and a way under network with long-term perspectives. We'd like to find out the practical and concrete action way to implement as one of the important agencies for this global development. So can you give us a couple of specific steps or actions that we need to do for the access to safe and affordable surgery care for all? So what can we do? The more concrete is the better for us. So my question is, can you give us a couple of specific steps or actions that we can do or that we need to do to provide a more better access to the safe and affordable surgical care for all? So I'd like to change the sequence. So here we have Hyun-won Kim. So you always present lastly, but please be first for this question.
Thank you. Yeah, the next steps and important items we need to think about action items. Actually, there are many things we need to start, but the obvious thing is we need to keep this kind of conversation even in the pandemic situation. We can be connected still. So this type of digital technology, digital transformation, or any type of innovative technology need to be considered to tackle on these kind of challenges, including safe and affordable surgery. And at the same time, we need to think about communication and engagement with community, because sometimes it's not because of the infrastructure, it's not because of the medical doctors' ability to do that kind of surgery, but sometimes in certain situations, the social and political situations or social norms are reluctant to get those kind of surgery, even though that is beneficial for them. So we need to think about those kind of, I'd like to echo the points, the paradigm shifts from the vertical ones to the holistic ones. Mm-hmm. So we need to be very able to engaging in the whole of the government, whole of the society approach at this moment. Thank you.
Wow. Thank you for your comment and your answer. Oh, I'm sorry, but let's be flexible a little bit. So I'd like to have a conversation internationally. So Korean partner said one thing, and then I'd like to invite Professor Miro. So could you give us a comment? Could you?
Absolutely. And then, coming from an academic institution, maybe I'll give my perspective in terms of academia and what might be the role of academia. And it certainly has a role to play and a supportive role. when you think about what is academia good at? Well, we're good at education and research. And if you look at the Lancet Commission, the commission found that workforce actually was one of the greatest rate-limiting steps in surgical care. So there are many parts of the world where workforce is a tremendous limiting factor. So I guess I would challenge academia and academic partnerships to ask the question, how do we educate a workforce for the 21st century and not the 20th century? What does task sharing look like in the 21st century? And I think it's going to look much different. How do we amplify our workforce with new information and communication technologies? So I think we're going to see many new ways to task shift and task share because of tremendous new information and communication technologies. And that can expand a workforce. On the research side, we need health delivery research, outcomes and impact research. All right, we need research that also addresses the social determinants of health. And I think that's very important. Health is not just a biologic function. There are also very strong social factors to health. And so research needs to be done to look at those social determinants of health. And so as all countries roll out these, quote, NSOPs, these National Surgical Obstetric and Anesthesia Plans, we need to monitor the impact of those plans and the investment in those plans, because we will find certain things work well and certain things don't work well. And then I'll finish by saying this. Academia must do all of these things through an equity lens. Our education, our clinical care, our research must have equity and justice woven into that fabric. And all forms of equity, race, gender, religion, ethnicity, sexual orientation. Equity and justice are at the foundation. They are the foundation upon which all of this must be built. Thank you, Professor An.
Well, your comment on the equity and justice, so remind me of our response because of the COVID-19. So up to now, we don't have any effective treatment. Now vaccination has been started, but the most effective way to prevent or to keep us safe from the spreading of COVID-19 is social distancing. So this social distancing brought the accessibility blockade between teacher and students. So our professor could not access to the students, and students also could not. So in that situation, we had to figure out another way, alternative way. So almost all, and not all medical schools, they had to find out a way to reach, to access students, and we are actively using the IT-based learning platform. So as you know, most professors at medical school, they are less positive and they are reluctant to use technology-based education, right? You know, to make a doctor, we need to meet them with face-to-face. But they had to adopt into a new educational platform. But what I realized while I'm experiencing the situation, in many countries, in developing countries, there are sustained and chronic accessibility problem to quality education. To strengthen and empower human resources for healthcare, they have a sustained perennial problem of accessibility because of another reasons. So the COVID-19 let us rethink how to access, how can we provide quality education to medical students and the healthcare professionals in what kind of way we can use and we have to utilize. So this, even the COVID-19 pandemic is definitely a serious crisis in medical education, but this was a really good chance to rethink about the possibility of medical alliance and a network for to empowering healthcare professionals global levels. So, I believe Mr. Kim, you have a great inspiration from our partners and their comments. So, would you give us what kind of actions that we can do?
Okay, I'd like to say this style of meeting must be more effective or constructive because I met with distinguished guests from the US and PG without flying to your two countries.
Right.
And also taking this opportunity, I realized the importance of international cooperation to cope with this kind of contagious disease. From now on, I'd like to say I will try to more strongly with my colleagues to cooperate with our partner countries to keep our human beings more safer. I'd like to say COVID-19 has taught us that the entire world should work together to keep all of humanity safe, as well as to promote sustainable development. This is the single most important lesson that we learned over the past year while suffering from COVID-19. I would especially like to highlight the importance of global cooperation in the health sector to move toward the future of co-prosperity. Thank you.
So, thank you. So, for me, it was a really good chance to have many promising words from our important fund. So now here, I would like to hear the Minister Wakanevity, and please give us your opinion. So what should we do, or what should we do as a next action or next steps for the development of the surgery for all? Can you hear me?
Thank you. Can you hear me?
Yes.
Hello?
Yes, we can hear you.
Okay. Yeah, thank you. The first things first is to recognize that there are countries around the world that have already begun with the ENSOPs, and that's what Professor Mira talked about. The 350 billion that's needed is a lot of money, and that's true. Mm-hmm. But there are countries, for example, smaller and developing states such as Fiji and Vanuatu have done their ENSOPs, don't actually need $1 billion. They need much less than that. They've got their plan together. So I think it's about identifying the countries that are ready, they've got their act together, and that and finding partners that are willing to support them. As I've alluded to before, with the economic constraints of COVID-19, small countries such as ours are going to be able to struggle to meet that. We're going to also struggle to be able to meet our SDGs. So being able to have a booster dose, so as to speak, of, for example, in Fiji, might be $5 million to be able to do what we want to do, will be enough to be able to take us forward. But also look at the countries that are regional in approach. So as I've alluded to, we are a country that actually hosts a training program for medicine, not only for undergraduate, but also for postgraduate. Can we also look at, for example, in the Africas, is there a country that's regional in its approach? Has it got its plan together? Can we actually give them a booster dose? I think that's one of the first things that I want to raise. And I don't want to sound biased because we've actually moved ahead, but I think it's a way of ensuring that we continue to gain that momentum. If not, what's going to happen is we're going to wait for the whole world to put their ENSOPs together, and that might take another 2, 3, 4, 5, 7 years, and no one really gets ahead. That's the first thing. The next thing is that from a global level, we've now been able to make it into the WHO Western Pacific. The next step now is to take it to the other 5 regions of the world. That's what needs to happen. It has to become an East Asian issue. It has to become the Americas issue. It has to become the Africa's issue, the Europe issue. And that's the next step. Because once we've done that, then it becomes a truly global public health issue. And that every country is reporting on a regular basis to the World Health Assembly on its milestones that it needs to achieve on a regular basis. So in summary, as I've said, let's look at countries that have got their plans. Let's look at development partners that are willing to support them. And a lot of, and some of these countries, for example, in the Pacific, the five of us that have done ours, we don't really need $1 billion. We need much, much less than that. But we've got our plan. The other thing is to ensure that we take this message out from the Western Pacific to all the other regions of WHO. Thank you.
Thank you. While I'm preparing this session, this is what I learned. The first is number. So I didn't expect that number, but the Lancet Commission tells us the 5 billion people, they do not have the effective access to safe and affordable surgery. So I don't think many of healthcare professionals, they do not think in that way. So how can we expand this understanding of what the desperate need to the colleagues in medical society? So could you share any of your experience to persuade or to expand or to tell them the reality as it is? Dr. Miller, please.
Professor Ahn, that's a fantastic question, and that comes up in some of our meetings. And you know, we sometimes say that we go to our global surgery meetings and we're preaching to the choir. You know, we're already, you know, we're true believers already. And I think it's important to get out of our comfort zone and out of our own communities and interact with other specialties and interact with other sectors. So I'm not an expert in the banking sector, but I'm on this wonderful panel with 2 folks from banks. So I think it's really important that we don't continue to go just to our own, quote, global surgery meetings, and that we interact with other medical specialties, other sectors, with governments, with WHO, with the World Bank, etc. Because if I just go and see the same people at the same global surgery meetings, we're not going to get that word out, as you mentioned.
Mm-hmm, mm-hmm. Thank you. And I have another question to Minister the Walker-Navity. So Hyunwon, she said many of our qualified, Korean qualified healthcare professionals, they are fully equipped in terms of medical technology or medical knowledge. But since they do not have enough understanding about the so-called local or domestic context of our partner countries, so even we don't have any intention to do, but we did make many mistakes. So based on your experience, so what would be the necessary caution that we need to have while we are having international collaboration? So because now we also have medical students who have interest in global collaboration. So could you share your wisdom or give us an advice? What kind of attitude or what kind of knowledge that we need to have when we do the collaboration across the cultures or between other countries?
Dr. Oh, our ENT surgeon is Korean.
Yeah,
and,
yeah.
A Koika volunteer, and he's been with us now for 6 years. Going on to 6 years now. So in another 2 years, when he does leave, and we're hoping he won't, but if he does leave, we will have 2 fully trained ENT surgeons. Now, I recognize when he initially came and worked with us as a colleague, the challenges that we faced. But I realized a few important things that we can learn from. Number one, he's willing to embrace the culture. His willingness to embrace the culture. His willingness to embrace, the level in which, we are, and to develop the department to where it is now. And his willingness to actually reach outside of Fiji, back to Korea and to other areas, to be able to get support. For example, in writing the guidelines that we have now in place for ENT, the training program that they have in place for both undergraduate and postgraduate. So that's happened because he's been here consistently for the last 6 years. In the new normal, that might not happen. But what we need to do is encourage people to be able to be digitally engaged as much as possible. When I say that is to say, look, from now on, you will have this mentoring, and this particular mentor will be your digital mentor. So whilst COVID-19 is giving us challenges, there are opportunities from COVID-19 that we could use to be able to, further enrich what we are doing. And as I said, the capabilities that are there in terms of the learning tools around, the digital age that we are now in, is far greater. We have to be a believer, and just like Professor Mueller said, being a surgeon, I said, how can one learn, without being able to have somebody physically present? But I've been quietly convinced with the way that, the digital age during this COVID-19 has shown us that you don't have to have somebody in the room with you. You can learn very well by remote. And I think that same thing that's happened with Dr. O over the 6 years, it has to be a consistent, supportive mentoring remotely, but over a long, consistent period of time, rather than a hit and miss. Thank you.
Yeah, but thank you. But my interest or my concern as a medical educator. So while we are using IT-based learning platform, it is not so difficult to provide information. But you know what? It's quite difficult to teach them kind of skills or the operation skills or some kind of attitude. So, do you have any comment or any way to help the learners so while you're
thank you.
Yeah.
Sorry, my internet is unstable. Can you hear me?
Yes, we can hear you.
Yeah. It is a work. It is an evolution. It is an evolution that we will work together on. As I've said, the two that we have, they have background knowledge. They have done the masters in surgery, so they're not really from zero. So there's been some relevant experience that they have before the training that's happened. But I guess what I'm trying to say is there's going to be a continued evolution with the way that we're going to work in terms of training. Now, we've had in the past up until now support through the Australasian College of Surgeons, the Royal Australasian College of Surgeons. And they've been coming on a yearly basis. For the last 1.5 years, no one has come. But it hasn't meant that there hasn't been any training. Our local surgeons have carried on the training banner, and they've done very well in continuing to train our local surgeons and train our local specialists. And sometimes we forget the fact that there is a platform locally. There's an intellectual capacity that's available locally within the low middle income countries. And that has to be encouraged, because as we've been talking about, that's the local context, the local knowledge that is actually very useful also.
Because I have another interest in the program. I mean, Professor Mira, you are directing the program for global surgery and social change at Harvard. So how many partners or partner countries or partner institute you have? And because we'd like to learn from your experience, because we also want to implement such kind of the cooperation among our Asian countries. So could you tell me about the program a little bit?
Well, so our program right now is involved primarily in research and working with, for example, ministries like Minister Wanga's on national surgical planning. And I think we really truly believe in what Minister Wanga was saying, that the length of the partnership is important, that a true partnership is important. It doesn't work to go in and do an intervention for 6 months and then leave. So
Right.
there's a concept that Paul Farmer talks about. It's called accompaniment, and the fact that you are a true partner and you work with people over a long period of time. Because you asked a very important question. You said, when you work in a country, do you have to come in with a certain way or with a certain behavior? And I think the word that popped out to me is humility and being humble.
Right.
And that we're there to work with partners and colleagues. I don't understand the complexities of Fiji, and I should not assume that I do. And I need to be mentored by someone like Minister Wanga. So the reason that our program is called the Program in Global Surgery and Social Change is that we believe in the social change aspect and in that spirit of accompaniment, that we're working together towards health equity and social justice, that we're not necessarily, we don't know all or understand all, but we have a lot to learn as well.
Thank you. So you mentioned a very important aspect of the long-term partnership or companionship. So I'd like to give you last question, Mr. Kim. So when we built the new hospital, the hospital building project, for example, it runs 3 years or 5 years. But when we provide a kind of policy consultation, the project usually go through 6 months or 12 months. So for the practical and wise, the policy consultation, we ought to have understanding about the complexity of the current or partner countries. But I don't think, as Dr. Mira said, it's enough to provide a consultation within the work of the 6 months or the 1 year. So what do you think? Is there any the plan to expand the year of work to provide a policy advice? So you have many kind of program to provide the policy in addition to the building facilities.
Okay, as you know well, we are the expert in financing.
Right.
So I can say that we are not the expert in procuring individual the medical project. However, to improve the project of medical sector, we usually work together with expert groups. As I said earlier, we are working with the Korea Foundation for the Medical Cooperation internationally, and also Korea, the KOICA, to make those medical projects more effective. In the process of preparing those medical projects, we are ready to cooperate with experts from Korea and also our partner countries. In the case of developing medical project, you don't have to hesitate to talk about what you want to make the project more effective. As I said, we are ready to increase medical sector projects from now on more and more. I hope the more chances to cooperate the medical sector project. Thank you.
Thank you. Well, I think it's time to wrap up our conversation because Professor Mira just passed the midnight. And thank you again. So because of COVID-19, you know what, it really becomes usual to have instantaneous international meeting through this IT-based platform. I mean, the time and space. So once again, I'd like to give my sincere thanks and appreciation to Minister Watanabe and also Professor Mira and Mr. Tae-soo Kim and Ms. Hyun-won Kim, and for sharing your precious knowledge and experience and your inspiring comment for the securing the access to safe and affordable surgery and anesthesia for all. Thank you. Thank you for participating. Thank you. Thank you very much.